Thank you very much, Mr. Speaker. Health services, the largest budget in government at $19 billion, continues to be plagued by inconsistent governance, which is reflected in high turnover of senior staff and continued low morale in the workforce. Allegations from Ms Kaminski suggest the dysfunctional relationship between the ministry and AHS continues to erode confidence in the organization and threatens not only fiscal responsibility, but more importantly, quality of care. Findings also made clear to me in the Premier's Provincial Addictions and Mental Health Review. Can the minister tell us how she will improve relations between her ministry and AHS?
Minister of Health.
Thank you very much, Mr. Speaker, and for the member for the question. Certainly public health care is public business, Mr. Speaker, and I am very proud to be a part of a government that makes sure that we don't placate our responsibility by pretending that we've got a business organization operating a business when really we're talking about essential public health care that Albertans count so desperately on. So certainly I have a very positive working relationship with my Deputy Minister, with the board, and with the interim CEO. I have to say it's been a breath of fresh air, and I look forward to that continuing to be the case as we move forward, Mr. Speaker.
Thanks, Mr. Speaker. Will the minister commit today, in conjunction with the new board, to survey Alberta Health Services staff to better understand current attitudes and concerns in relation to the organization? Yes or no?
Minister of Health.
Thank you very much for the proposal, Mr. Speaker. Certainly it's an interesting idea. I want to make sure that I'm aware of what types of surveys there are currently in place and make sure I have an opportunity to review those as well. I make sure that I'm out on the front lines having opportunities to engage firsthand. During the 2-week constituency break, I was in 11 communities meeting with AHS leaders and frontline staff, and that continues to be a priority of mine, as well as my Associate Minister, Mr. Speaker.
Second supplemental.
Mr. Speaker, given that the government changed the rules for appointments to the board and appointed Mr. Richard Discerny, then head of civil services, to the AHS board, will the minister review this decision as a barrier to the kind of accountability and transparency that are needed?
Minister of Health.
And independent.
Thank you very much, Mr. Speaker, for the question. Certainly, I'm very proud of the complex skills and the expertise that are around the table. Mr. Discerny was selected because of his extensive experience understanding both the public service and Crown corporations. He has over 35 years of experience, and even though he's retiring from the public service, he's agreed to stay on the board, and I'm very proud of that. Certainly, the rules that were in place under previous boards of AHS were that you couldn't have any revenue from the Government of Alberta. You couldn't be engaged as an Alberta Health or Alberta Health Services employee. I think it's important that we have expertise around the table, including health expertise and government expertise, and I'm proud of the board we have.
Thank you, Honourable Minister. Member for Edmonton, Mill Creek.